Case Study Spontaneous Complex Report of PV. A spontaneous complex report in pharmacovigilance is a report that includes multiple drugs, medical conditions, and events. These types of reports are often challenging to interpret and require careful analysis to identify any potential safety issues. Here is an example of a spontaneous complex report in pharmacovigilance. A 60-year-old male patient with a history of hypertension and diabetes mellitus was prescribed metformin and lisinopril for the management of his medical conditions. He presented to the hospital with complaints of severe abdominal pain, vomiting, and diarrhea. The patient was diagnosed with acute pancreatitis and was treated with intravenous fluids and pain management. The patient had recently started taking diclofenac for the management of his back pain, and the medication was prescribed by a different physician. The patient had not informed his primary care physician about the new medication. The patient's medical history, medication use, and adverse events were reported as a spontaneous complex report to the National Pharmacovigilance Center. The report included multiple drugs, medical conditions, and events. In this case, the spontaneous complex report included multiple drugs, metformin, lisinopril, and diclofenac, medical conditions, hypertension, diabetes mellitus, back pain, and acute pancreatitis, and events, abdominal pain, vomiting, and diarrhea. The report was analyzed to identify any potential safety issues. It was noted that diclofenac can increase the risk of gastrointestinal adverse events, including pancreatitis. The patient's failure to inform his primary care physician about the new medication may have contributed to the development of the adverse event. The report emphasized the importance of patient education and medication reconciliation to prevent adverse events related to drug interactions. Spontaneous complex reports are valuable in pharmacovigilance as they can provide important insights into potential drug interactions, adverse events, and patient safety issues. The analysis of spontaneous complex reports requires a systematic approach, and the following steps can be taken. Data collection. The first step is to collect all relevant information about the patient, including medical history, medication use, and adverse events. Causality assessment. The next step is to assess the causality between the medication use and adverse events. This can be done using various causality assessment tools, such as the Naranjo algorithm or the WHO Uppsala Monitoring Center Causality Assessment System. Signal detection. The next step is to detect any potential signals or patterns in the data. This can be done using statistical methods, such as disproportionality analysis or time-to-onset analysis. Risk assessment. The next step is to assess the risk associated with the medication use and adverse events. This can be done by reviewing the available evidence from clinical trials, observational studies, and other sources. Communication. The final step is to communicate the findings to healthcare professionals and regulatory authorities. This can help to inform prescribing practices and regulatory decisions related to the medication use. In summary, spontaneous complex reports in pharmacovigilance are challenging to interpret and require careful analysis to identify any potential safety issues. The example provided highlights the importance of reporting all medications and medical conditions and the need for patient education and medication reconciliation to prevent adverse events related to drug interactions. Spontaneous complex reports in pharmacovigilance provide valuable information about potential drug interactions, adverse events, and patient safety issues. The analysis of these reports requires a systematic approach, including data collection, causality assessment, signal detection, risk assessment, and communication. The findings from spontaneous complex reports can help to inform prescribing practices and regulatory decisions related to medication use.